Hello, everyone. Welcome to the Module 8 instructor presentation for sensation and perception. And first, I'd like to just say congratulations. You've all reached the last module of the course. Should be about wrapping things up. On behalf of myself, St. Leo, and of course your instructor and everyone else involved, I hope that you enjoyed the class in these last days of the course. At any rate, let's go ahead and get through this Module 8 presentation. Once again, I'm going to go through some of the themes and the concepts found in this last module. Here in this particular module, we're going to explore the senses that, unfortunately for those studying it, they always get sort of left at the end. Really the bulk of the research in sensation and perception is the visual system, followed by the auditory system, and then of course, the remaining senses are important, but they don't tend to get quite as much research, although pain perception does get a good amount, which I'll get to in a minute here. But we have the sense of touch, gustatory, and olfactory. Olfactory is a sense of smell, and gustatory is our sense of taste. They haven't gotten quite as much research as vision has gotten. Probably because, I would imagine, for most people, vision is probably their most important sense, but they're all important. They all tend to work together at any rate. But anyhow, so let's go over these themes and concepts. So we're going to do an overview of the sense of touch. This is also called the somatosensory system. I want to spend a little bit of time on pain, because pain is, as unpleasant as it is a rather important sense. You can certainly think of that from an evolutionary perspective. I also want to include in our discussion of pain top-down perspectives, the role that emotions and cognitions play in pain perception, which is quite interesting. A brief overview of the gustation and olfactory processes, and this last point, which I've been making the entire time, and our perceptions are the result of our nervous system activity. I really want to just drive that point home. I've driven it to death, that our perceptions have a very, very strong, significant, subjective quality to them. I am not saying that the universe around us does not exist and it's just a dream. I'm not saying that at all, but how our nervous system works directly results in the types of cognitions, perceptions that we have about the universe. There's just no way around it. So that's why studying perception has always been so important for philosophers and for psychologists. Okay, so let's continue. The somatosensory system. I'm going to just do a brief overview here. I cannot go into all of this, although this other material, of course, is found in the text. There are different parts of this system. There's three major parts: the cutaneous, proprioceptive, and kinesthesis. The cutaneous is what we'll focus on here, and that's perception of touch, which is regular touch and pain. And there are actual separate neural systems for touch and pain. It's not like that one system is used for both. I mean, they're involved with both, but just regular touch and pain actually have separate neural pathways. Proprioception and kinesthesis, we're not really going to go into, but you should note that you can see proprioception, the ability to sense position of the body and your limbs, and kinesthesis, ability to sense movement of the body. Those are very important to athletes, obviously, but we're not going to go into that. But it is not for this particular talk. So the cutaneous. Now, one thing you want to pay attention to is note the different types of receptors that are found in the cutaneous system. Of course, we're talking about the skin. All right, and then your author mentioned some interesting facts about the skin. Incidentally, it is the heaviest organ of the body, and it does offer some protection for us. It protects us from dangers, chemical agents, and stuff like that. And you can see that we have the different layers: epidermis, the dermis, and you can see some of that shown here in a cross section. The epidermis being the top layer, then we have the dermis, which is much deeper. The main thing here is just to go through and note the different types of receptors that are found throughout the skin. And what we basically know is that these different receptor types have different physical shapes. These different shapes, by the way, this is called a morphology of these cells, their shape, and that shape gives rise to different types of functions. So different types of shapes tend to conform to different types of functions due to the physics of the shape. By the way, that's a study of morphology, interestingly enough. And you can see here that we have these Merkel receptors, and we have Meissner corpuscles, and like the other senses, you have the physical stimulus, which could be pressure, it could be some sort of pressure, or it could be some kind of fluttering on the skin, or whatever the case may be. Stretching and these different physical stimuli result in different perceptual experiences. And here we see the Merkel receptors. These tend to be more involved with the texture, the perception of fine details and textures of objects as you touch them, for example, with your fingertips. And the Meissner corpuscles tend to be more involved with things like hand grip, when you're squeezing a ball and whatnot. So that's interesting, and that's shown here. You can see Merkel. Once again, due to the morphology of the receptor and how they tend to work, what their physiology, they're each involved with different types of perceptual experiences. So you can see Meissner with hand grip, things like that, when you're holding on to, let's say, a ball, or when you're holding on to a pencil. Merkels are responsible for sensing fine details of objects, because you can, that's called haptics, by the way, using your somatosensory system to do object identification. That's in I'm not going to really go into that too much here. I just wanted to mention that is in your text. We also have the Ruffini cylinders and the Pacinian corpuscles. All right, and once again shown here, they also, like the others, they have their own physical structure. And you can see there the Pacinian corpuscles and the Ruffini cylinders located here. Ruffini are more involved with stretch, so if the skin is being stretched, and Pacinian corpuscles are more involved with vibration. So if something is vibrating onto the skin, these tend to, due to their physiology, tend to respond more to those types of stimuli. All right, so once again, you can make sure you look through that in the text. Also note the major neural pathways of the somatosensory system. We have two major ones. The medial lemniscal pathway, and once again, these are, remember, the brain, the nervous system is essentially divided up into sensory motor regions, and the sensory regions basically start out in the distal or peripheral areas. In other words, out there, let's say in your hands, your arms, your legs, your feet, or whatnot, and those signals come inward, medially towards the middle to the spinal cord, and then they go up to the brain, and then so that information goes from the out in, then up. And that's the sensory pathways, and that includes the medial lemniscal. And the medial lemniscal pathway carries that proprioceptive, and also for what we're talking about, touch. So as you touch something, as you touch the keyboard, you are activating the medial lemniscal pathway. Spinothalamic is more involved with pain. So when you touch that, you go in the shower, and let's say you have it set really hot, and then you forget that it's really hot and steamy. You go in there without thinking, boom, you get hit by the hot water. Your spinothalamic is going to be activated. So temperature and pain tend to be related, although temperature can also feel good. All right, so it's kind of complex there. These pathways cross over to the opposite side of the body and synapse in the thalamus again. So once again, we see that theme again where like all the other systems, the sensory systems, pretty much, you're going to get thalamic input. All right, so remember, the thalamus is composed of a bunch of different, and you can see the thalamus here. So here we have these, here's the spinothalamic tract as an example. There's medial lemniscal. They're running upwards. Think of them as like a highway. They're going up, and then boom, they hit the thalamus, and from the thalamus, it's going to go off generally to the cortex. You have these what are called thalamocortical pathways. What they're not showing, of course, is that you also have feedback going down from the cortex and so forth, but that's okay. Ultimately, you're going to stimulate these cortical regions, such as the somatosensory cortex. This is involved with the cutaneous senses. All right, and that's shown here. And just once again, this is another, another common, I guess you can say, a concept or theme throughout the course. Mapping again. We have a body map, which is affectionately called the homunculus. It's located on the cortex. Different parts of that somatosensory cortex have served different parts of the body. And when you map it out and you make it a little picture, you get this weird-looking guy. This disproportionate-looking fellow there, he's called the homunculus, so to speak. And you can see, what the text is showing you here is that different portions of that cortex, this is the somatosensory cortex, different parts are serving different parts of the body, and there's this organization there. What's interesting is just like what we found in the fovea, where you have And the visual system in the fovea, which got more cortex allotted to it than the rest of the retina, which is called which was called the magnification factor. We see the same type of thing again with this system, where the lips and the hands and so forth get disproportionately more cortex devoted to it, and that is because this requires the highest amount of resolution and so forth to be able to manipulate objects and so forth. The highest tactile acuity is represented there. You got to be able to grab when to work with tools, you need lots of neurons for the fingers, basically. That's what we're looking at there. Once again, this is all this is the somatosensory one, and also like the other systems, we have multiple areas. But the somatosensory, by the way, is part of the parietal lobe, and that's shown there. Once again, body areas with high acuity have larger areas of cortical tissue devoted to them. So there's that point I'm making. This parallels that magnification factor in the fovea, and so forth. So be aware of that. This is all, of course, is in the text, so make sure you look at that. Okay, so that's a nice little overview of the cutaneous sense. Shifting now to pain, all right? A lot of my students, they get anxious and they worry. They tell me they're scared, especially towards the end of the term. It's understandable, anxiety, and we have these emotions. You have lots of things going on in your life. Well, what's interesting about that is all of those cognitions, those emotional responses, all of your experiences, your personality type, and all of that kind of stuff, perhaps your temperament, whatever the case may be. All of these things that can have an impact on pain perception. It's kind of interesting. It's a multimodal phenomenon. All right. So we have that sensory part. We have that actual stimulation. But then we have affective. And affective, the A there, we're just referring to the emotional aspect. All right. But what's not listed here, of course, is also cognition and things like that, all the other things I just mentioned. But there are a lot of top-down processes involved. But you can see there's lots of different kinds of pain. I teach a psychology of aging course, and I tell my students that we're out of Florida, and there's a lot of older folks that live down here in Florida. And I always tell my students, I say, there's going to be a real need for more psychologists helping out older folks because the aged population is just getting bigger and bigger. And one of the areas of study that we need to really get more and more research in. I mean, there's already a good amount, but pain research, because when they're older, boy, they start suffering from all kinds of chronic pain. And so an understanding of all of these systems is really important because right now, all we're really doing with pain is just throwing drugs at it. And that's not a sustainable solution. We need to figure out different methods to stop pain and so forth. But you can see but anyway, I digress. But here you can see some of the different types of pain. Inflammatory pain, neuropathic, nociceptive. Inflammatory, it's caused by inflammation. So that's when you can possibly have tissues that are getting inflamed due to injury. They're literally getting larger. So like, for example, if you anytime if you have some kind of it could be any number. You could have a bacterial infection, which causes one of your parts of your organs to literally swell up. That's going to cause pain. It can also be related, of course, to something worse like tumor cells, like cancer, or whatnot, or benign tumors, I guess. But inflammation is a common problem with folks, especially as they get older. And inflammation tends to cause pain. And there's a whole line of anti-inflammatory drugs that help with that, at least temporarily. There's also neuropathic, and this is where the actual nerves are being maybe crimped. It could be damage due to the brain itself. Carpal tunnel is a case of neuropathic pain where the actual nerves along the sensory pathways are being compressed, for example, and that's causing neuropathic pain. A lot of folks, as they get older, they get herniated discs in their spine. And that tends to cause those sensory nerves that are coming in there to be compressed. And that could cause a lot of pain. I have student athletes, that they get neuropathic pain from things like this because they get injuries when they play in their sport. And finally, we have the nociceptive pain. Nociceptors are specific types of pain receptors found in the skin that get activated in particular to things like heat, chemicals, severe pressure, cold, like extreme temperatures. And these, and that's what's shown here. This is sort of interesting. So these nociceptors respond to various types That wouldn't be pleasant, a hammer, right? Getting a hammer there, but you can see the cold. Once again, these are all signals that are, presumably going to activate the spinothalamic pathway, right? Um, but what about some of the, I guess, what about some of the theories on pain in terms of how we need to develop a model of pain in the body? Well, one of the older models is something called the gate control that's been around now for quite some decades. And it's a relatively simplistic model of how the pain system works in the body. And it's not entirely accurate, but it was a great starting point. And because of that, Goldstein has kept this in his text now for, for since I've been teaching this, and it was a long time ago. It's more complicated than this, but this is a great starting point. Um, Here you can see the history, a little tiny bit of history. Early models stated that nociceptors are stimulated, then they send the signals to the brain. This was called the direct pathway. So the idea is that there's these pain receptors. You activate them, and you feel pain. Done with it. It's pretty straightforward. Um, there's a problem with that, and that's those top-down mechanisms that I talked about earlier. So I want you to be aware of that you can have these top-down components here. Your mental state can affect your pain perception. So your attention, right here, the attention. I mean, I think you've all probably had that experience where, let's say you have a headache, you have maybe your eye aches from eye strain or any number of things. And as you get involved in a task, it's like the pain goes away. It's kind of nice. Um, and also, pain can occur when there's no direct stimulation of these nociceptors. So that's kind of interesting. How do you account for all of these things? Well, it turns out it's rather complicated. And also, here's a subject students are always fascinated with: phantom limbs, right? How is it that a limb that's not even there, right, that has been amputated, how can it cause pain in the first place? That is, how can you have pain when there's no nociceptors in the first place, right? Because they've been removed. So this is a very interesting phenomenon. Students are always interested in, and many students, almost every term I get students that want to do papers on this phenomenon. All right. So what about the gate control? The gate control just accounts. It was a multimodal theory. Okay, so gate control says pain signals enter the cord from the body and transmit to the brain. Additional pathways that influence the signals from the cord to the brain can open or close a gate in the spinal cord. All right. So the idea was, and the theory focuses on activity in the spinal cord, which makes sense because that's where the spinothalamic pathway is. And here we have different sort of players in this. We have the nociceptors, we have mechanoreceptors, which these would be more like your traditional touch. I mean, think about when you have pain and you're uncomfortable, you've hurt yourself, and you rub your shoulder, or you rub those areas, or you get a back massage, and you can have that relief, which is sort of interesting. This kind of accounts for that, at least in part. So here you can see signals. You've got literally the pain gate that can be open or closed here. Here, for example, we have the signals from the nociceptor. So that could be that's going to be a pain, that's going to activate that's going to be pain, essentially. This means that the gate's going to open, and then that signal is going to go up to the brain. That pain's going to go up, and that's going to be a signal of pain. Here we have the gate closing signals, and this could be from the mechanoreceptors. All right, so let's say you've hurt your back, and you're getting a nice massage. The massage is going to stimulate the mechanoreceptors. You're going to get that's going to stimulate the mechanoreceptors. And when those mechanoreceptors are activated, you're going to tend to close the gate. All right. Okay, so you can see cross-section of the spinal cord showing fibers entering through the dorsal root. That's the sensory portion of the spinal cord. Okay. And then you have this central control, which presumably would be other neural structures that are monitoring the activity. This could be things, this accounts for maybe your cognitive or emotional state. So perhaps through meditation techniques, through maybe stress relief techniques, you can close that gate. So while you're experiencing that pain, you can activate these inhibitory processes, which essentially close the gate. All right, that can essentially close that gate. That's the idea. Now, this is a nice sort of beginning place to go to when it comes to pain perception, and it's really served as a foundation to explore all of this in a bit more detail. What I like about it is that it does account for these top-down processes, things like your attentional mechanisms, whether or not you expect the pain to come or not. You can see here expectation. When surgical patients are told what to expect, they request less pain medication and leave the hospital earlier, right? So that's kind of interesting. Here's an example here, the placebo effect. Okay, that's kind of interesting. So if you think you're getting a painkiller, and if it's a sugar pill, it might actually work at least sometimes. But attentional mechanisms can also help. So that's very interesting to me. You can also see emotions. Interestingly enough, once again, you can look uh, you can explore this in the text a little bit here, but um, inducing a positive mood, can actually help, at least in certain studies we can see here, and samples in these studies help people endure pain longer. All right. So positive mood means that you can handle pain. At least that's the theory. Versus, the opposite, of course, is in these studies having subjects look at images that are particularly negative. In other words, inducing maybe more of a depressed mood. You tend to have a less, or I should say, an increased sensitivity to pain. And that's interesting. And music might have this effect on helping induce positive mood, which means that you can handle more pain, which is sort of interesting. So, once again, those top down processes are interesting to consider. Of course, a lot of times we tend to turn to medication for pain, and this can be just fine if it's not abused, but we know opioids. And of course, in the course here, you have some. I've included some links that explore this in much more detail. Um, but we have the natural painkillers, the endorphins, right? These are natural painkillers of the body. They're endogenous, meaning they're made naturally inside, so to speak. Endorphins do reduce pain. Naloxone here is a drug that tends to block the endorphin sites, and this will actually cause pain because you're blocking the effect of endorphins. This is sort of interesting. People whose brains release more endorphins can withstand higher pain levels. So we tend to vary on this, which is very interesting. We tend to vary on this, and here you can see this is naloxone, which is a structure similar to heroin, reduces the effect of heroin by occupying a receptor sites normally stimulated by heroin. Yeah, naloxone, this is sometimes used to help heroin addicts uh, get over the addiction and so forth. But at any rate, I just wanted to mention that a little bit. Another thing that's in your book, which is interesting, empathy, essentially, observing pain in others. This is in the chapter, and this is essentially studies that have been going on now for quite some time on the mirror neuron system of the body. This is another interesting aspect of the brain where it's the social brain. What happens when, we all think about, okay, if I'm in pain, when we look at, okay, the spinal thalamic system is being active, and we can go back and look at the gate theory and other theories to think about me as an individual. But what about when I look at other people? I don't know if you've ever had that experience of looking at someone who's in pain and feeling that twinge. All right, that's empathy to a certain extent. I guess we all vary on how much of that response we're going to give. But it turns out that and this is shown here based on some of the research out there, we have similar parts of the brain, not exactly the exact same, but when I watch someone, let's say watching a partner receive painful stimulation, sometimes we have an overlap in some of the activity of the brain. This is essentially an empathy. I can empathize with you, and I feel your pain, so to speak. You can notice here, empathy did not activate the somatosensory cortex, which is up here on the top, but did activate other areas that are activated by pain. Okay, these are some other parts of the cortex. So this could explain, or at least it shows the correlation of maybe certain parts of the brain that literally are affected by just watching others. This is almost, parts, like I said, it's like the social brain where we have our ability to empathize. And we call these mirror neurons, which is really interesting. And there's systems like this throughout the brain. Like if I'm watching someone riding a bike, certain parts of my brain will be active that are involved in the motor system just by watching other people engage in a motor activity. It's not exactly the same as if I were to get on the bike and do it myself, but there's an overlap. This is similar here, and it might, so this whole um, series of structures that perhaps are involved with this empathy are quite interesting. And that's what I said. It's the merging of neuroscience with things like social psychology and so forth. Okay, so there we go. That's basically what I wanted to cover in the somatosensory section. So now let's do an overview of the chemical senses, gustation, olfaction, and then we'll be done. All right, so just want to do a little bit of an overview here. The chemical senses, gatekeepers. All right, so when we think about the sense of smell, we think about the sense of taste. um, we're thinking, like here, we're talking about gustation, which is the sense of taste a bit more. Gatekeepers, identifying things that could be consumed. All right. We want to avoid harmful substances. We want to take things into our bodies that are good for us. Now, this system is not perfect. It is perfectly possible to accidentally consume things that are harmful, of course. But certainly, there are certain substances that have such a foul odor or taste that they're almost reflexively that they would be spit out. And that's so we can thank our chemical senses. Without that, God knows what would happen, right? But here you have the basic taste qualities: salty, sour, sweet, bitter, umami, which is sort of interesting. I don't know if any of you like this. This is that MSG type taste. It's meaty, brothy, savory. This is a very good taste, I think, but it's generally associated with things that might not be good for you, but still very tasty. I guess it depends on what more precisely what you're eating, but whatnot. Um, but these are some of the different tastes, qualities, and you can see here some of the connections here between taste quality and the substance's effects. Sweetness is usually associated with a substance that have some sort of nutritional value. Bitter associated with substances that are potentially harmful. But once again, this is not perfect. You obviously have experiences where you might have a little bitterness in a food, but it's still not bad for you. Salty indicates presence of sodium. Although I like to point out that you cannot, just by taste alone, know what the sodium content of something is. Sometimes it's hard to detect that. We're not that good, but we can get an idea. But yes, this is the point here. There is not a perfect connection or correlation between the taste and the function of substances. You cannot bite into a burger and figure out exactly the fat content or exactly the sodium content. It's almost impossible, but you get general ideas. When you're reading the text, of course, look over the anatomy. We have the anatomy of the tongue, which contains the papillae, which has you can see the filiform, the fungiform, the foliate, and so forth. These are all the different parts of the tongue, and along that you have the different types of taste receptors that are shown here. All right, so the idea is that different substances activate different receptors, and then these will more or less, you can see you have like different receptors being activated to a certain extent by the different types of, different types of substances like bitter, sweet, sour, and salty, which those signals then, we have the transduction here, and then that ultimately the gustatory nerves are activated. So make sure you look through here. You can see some of this all in your text. Taste cells, so you can see here. These are where the receptors are located, and that's where you have the transduction occurring. All right, transduction is occurring there. Interesting, you can see some facts here. The tongue has about 10,000 taste buds. You can see here. Once again, you can see there's a nice close-up of the tongue with all the different taste cells. So make sure you go through and look at the anatomy. It's pretty straightforward. Here you can see a little overview of the taste system. Once again, we've got some of the nerves involved there. There's the nucleus of the solitary tract, the vagus nerve, the glossopharyngeal nerve, the chorda tympani, making an ipsilateral projection here to the insula and so forth, and some different parts of the cortex. And once again, here you see again, there's the thalamus. So we've got that signal there going to the thalamus, and then from the thalamus to the cortex. You're starting to see a pattern here, right? And there, once again, there's the definition. So you can see these different nerves are getting signals from different parts of the tongue. All right, different nerves are getting signals from different parts of the tongue. So a nice organization there to note. Okay, and then once again going to the cortex. So make sure you note that anatomy there. Um, this is, in terms, I just wanted to mention this here, sort of to wrap up the gustatory system because I'm not spending much time on this. Um, One of the issues you address in this particular chapter, module, whatnot, is specificity versus population coding. How is it that we can, what is it about um, the substances that we're eating, in terms, maybe it's their chemistry, other factors that determines what we taste? I mean, is it something that, I mean, does every single substance we eat, we have this certain, does it produce its own sort of code so that we can differentiate between a burger and hummus? I mean, how do we know the differences there? Um, there is no agreed upon explanation for this, right? So there's evidence, and you can see in your text for what we call this more distributed or population coding versus specificity. Um, do we have there's a lot, it's just like the other, in other aspects of the brain. Is it, do we say that, there's a pattern of activity in the brain that accounts for maybe a particular taste? And there's some evidence for that. We just don't quite know. I guess that's the point. We don't have an agreed upon explanation for how is it that we can differentiate between different types of food, which is obviously very important. We'll see with olfaction that you can have substances that are very similar in their chemistry but have vastly different odor experiences. All right, but they might produce different patterns of activity in the brain. So what's interesting here is that we have different types of neural activity going on. All right, but we don't necessarily have something as specific as, I'm activating my Big Mac neuron. So every time I eat a Big Mac, if that's what you like, okay, this particular neuron is going to get activated. All right, it doesn't appear to be that simple. All right, but we just don't quite know. Now, kind of shifting on to olfaction, which is related to gustation, the two senses tend to work together. Here's our sense of smell. Um, Humans, we say, are microsmatic versus macrosmatic. I would argue that our sense of smell is pretty good, but it's not quite as important, comparatively speaking, as to, let's say, a canine, right? Your typical hound dog, for example, is going to have a very keen sense of smell. They have a much more developed olfactory system than we do. We um, use that sense of smell for a variety of things, and it's important to a certain extent, but it's not, I would say, as necessary for survival as, let's say, the visual system. The visual system is clearly more important for humans, and just look at the brain, and you can see that there's so much more cortex allotted to the visual system versus a relatively small amount in the human's cortex devoted to olfaction. That gives you some idea. Um, and there's possible, you can see here some examples of pheromones. This is what's shown here, that the olfactory system could be involved in sexual attraction and stuff like that, which I'm not really going to go into, but that is something to note, um, and so forth. And you can see her just kind of going through here, using some of the methods that are described here, basically psychophysical methods. It turns out that humans are not terribly effective at identifying odors compared to other things, other species. For example, rat, 8 to 50 times more sensitive to odors than humans. 8 to 50 times more sensitive to odors than humans. Dogs 300 to 10,000 times. All right, there's a reason why the canines are used to sniff for drugs, and not humans. That would be ridiculous. We just would not be able to detect them. Um, we just simply lack the number of olfactory receptors they have. Humans have about 10 million. Dogs have a billion. All right, so that's a huge difference. So you can see here, and you could just see some of the odor detection thresholds just to give you an idea there. Our system is pretty sensitive, but which is useful for identifying potentially, like formaldehyde. That's potentially nasty stuff right there. Um, but certainly the canine is far better at, it evolved a much better olfactory system. Um, Once again, like taste, the puzzle of olfactory quality, researchers have found it difficult to map perceptual experience onto physical attributes of odorants. Um, you you can have a situation, once again, I mentioned this before, similar chemical structures can smell different, and sometimes you can have structures that have vastly different chemical structures, but they smell quite almost the same. So this is once again, it's we're trying to figure out, is there a relation? Well, sometimes there is. Sometimes there might be a relation. So you can see here musk, which is very strong. Musk is very strong versus no odor. It's pretty close. I mean, there's some subtle differences here, um, but obviously those are quite strong. And then here we see these two organic structures. They're quite different, but both have, to a human observer, they both smell like pineapple. So that that's what at first we thought. Hey, maybe it's just the chemical structure. Well, it's not that simple. Um, so that's one of the puzzles there. So just trying to, how is it that we can identify all these different odors in the first place? So what is that connection between the physical stimulus and that subjective experience? Not quite certain. Another question, of course, is this that's your author mentions, and rightly so, is look at this. Here's a typical breakfast. Looks nice. There's some bacon. You got orange juice there, some coffee, maybe some toast in the background you don't see. How is it that you can, and all of these odors all mixed together, all of these odorants, they're all mixed up. How can I identify each of these things separately? And it's done rather easily. I could, making breakfast, I can easily discriminate those odors. How is it that we do that? Well, obviously it's something, neural mechanisms of the brain that we're just not quite sure of yet. All right, so that's the puzzle of olfactory quality. Um, to make a long story short, what a lot of neuroscientists are looking at is patterns of activity in the brain. That maybe certain patterns of activity in the olfactory system are correlated with particular odorants. All right, and that's the idea. But that's once again that's evidence for almost a distributed coding scheme, um, as opposed to having in your brain the coffee cell that's going to get stimulated when you smell coffee. It's probably not that simple. Note some of the anatomy, and so I can go through briefly here as we get closer to the end. There's the olfactory mucosa, and that's inside the nasal cavity. I'm sure you've all had some kind of sinus infection before in your life, or maybe you have allergies where you can have a lot of congestion in the sinuses. Well, the reason why you can't smell things is because the mucosa is getting blocked up. Essentially, you have the olfactory receptors in your sinuses there, in the nasal cavity, and um, the odorants physically attach to those receptors and cause the receptor potentials in there, and that's showing you some of the anatomy. And once again, you can review the details in your text, but I can zoom in on that just a tiny bit. You have the mucosa. There are those odorants stimulating these olfactory receptors, and then you have these with a glomerulus here that's located right in there above the bone there, and this neural structure is going to basically it's going to synapse and send off to parts of the olfactory cortex and whatnot. That's what they're showing here. So it's right there. The olfactory cortex is located right up there near in the frontal lobe area. All right, and that's what's shown there a little bit. But what's interesting here, and that's what's shown here, is we have this glomeruli, and they're essentially making specific connections to olfactory receptor neurons. Okay, that's what they're showing you here. Once again, this is all in the text, so you want to make sure you look at that. And here's that point I was trying to make earlier. Patterns of activation here, in this case, some research with the rat. Different odorants that are shown here on the bottom produced relatively distinct patterns of activation within the olfactory bulb. And the olfactory bulb is part of the brain. It's in the essentially part of the olfactory cortex of the animal. Rats are used, by the way, because they have a very large olfactory bulb, much bigger than the humans. Rats use their sense of smell quite a bit more than we do. That's why when you see rats, they're sniffing constantly. But anyhow, there's that patterns of activation that seem to be important. So once again, so you could potentially have things that are, if the pattern of activation is similar, um, regardless of the chemical structure, right? You might, one would expect that response is going to be similar in the animal, which is interesting. So, that still doesn't answer the question. Why is it that you know how what is it about that physical stimulus though that's important, and it's just basically a mystery. Um, so once again, kind of looking here, the signals from the olfactory bulb are sent to the piriform cortex and the temporal lobe, and finally to the amygdala. Now, all of you, I'm sure, have no doubt had that experience of, you smell something and, oh my God, this is revolting. Oh, it's disgusting. And you have that strong emotional reaction. Or you smell something like roses. Oh, that smells so nice. Well, there you go. The amygdala is part of the brain that's involved with emotional responses. And so smells and tastes, by the way, I didn't mention this before, but our gustatory system connects to the amygdala as well. Um, there's the emotional part. Okay. And then, of course, it goes to other parts of the brain as well. And just to finally point something out, the Proust effect. Um, new, the sense of smell, the olfactory system has a very strong connection to the amygdala, and the amygdala also has a strong connection to the hippocampus, which is part of the brain that is involved with memories and such. And the Proust effect is simply the ability of taste and olfaction to unlock memories. And no doubt, I don't know if you've had that experience. Perhaps the smell of perfume or a type of cologne can make you think of a person, and maybe someone, maybe a romantic partner or whatnot, or someone that you know, and that could really serve as a wonderful cue for recall. Perhaps you're having a meal and all of a sudden a memory pops up. Well, it's not magic. It's just how the neurons are connected, or at least there's a strong connection there, and often that amygdala is important for memories because things that have a strong emotional content to them will be more easily remembered. Okay, well, I know that went a little bit longer than normal, but I hope that this was helpful to all of you. And please, if you have questions, obviously contact your instructor. And I hope that you have enjoyed the course, and you all have a great week.